celebrating 13 years of possibility. Halloran Hilton Hill and Pilot Flying J present Anything is Possible. Today's guest, Tony Spezia.
Welcome to another edition of Anything is Possible. My name is Halloran Hilton Hill. These are great stories about great people whose lives prove that anything is possible. My guest today is the CEO of Covenant, Tony Spezia. Good to see you again, my friend.
Great to see you, Halloran.
So you realize that this season we go over 320 episodes, and let me just start by saying that Covenant has been a great partner of ours, powering possibility all these years, so thank you for that.
Listen, we're proud to do it.
To remind people about yourself, I want to talk about a wide range of things. I want to talk about healthcare today, especially. You grew up in St. Louis. Take us back to St. Louis and growing up in a big family in a great city.
Yes, of course, everybody in St. Louis is a Cardinal fan.
Right.
But grew up, was born on a place called The Hill in St. Louis and lived in South St. Louis. And The Hill is essentially an Italian-American area where, you know, even today you can go there and they pretty much speak Italian in the stores and things like that. My dad's father came to the United States with my grandmother. I was telling you that he sort of deserted the Italian army in World War I, and that's when we knew there was a little intelligence in the Spezia family. And he came over and settled there. He was a laborer and never really learned how to speak English because it was an Italian area. But came with the Bears and the Garagiolas, two pretty famous names in baseball. And of course, I grew up kind of loving baseball because of that.
You told me about the small town that your family harkens back to, and you said there's a sign there.
Yeah, well, we went, of course, when my son graduated from high school, I said, what do you want to do? And he said, well, I'd like to go back to where the family came from. And so me and my brother, who's his godfather, you got to take your godfather with you if you're going to Italy. And so we went back to this town in northern Italy where our family was from, and there are two streets there. One said Via Detroit and one said Via St. Louis, and everybody on the one street had emigrated to and ended up settling in Detroit, and the other street was St. Louis, and of course that's where I grew up.
So it was the Spezias,
the Garagiolas, and the Bears.
That's not bad.
No,
not bad at all.
It was good.
So let's talk about coming to America, your father's American story, your grandfather's American story, your American story. The American story is a story of possibility. I would throw out, and then you can confirm or deny, that the reason they chose America is because the possibility, the potential that something can be is here. Can you speak to that?
Absolutely, and I think that one of the things that was very clear, and even though they did live in this Italian area, they very much wanted to be American, and they wanted to embrace what America was about, what America stood for. And my father, who I think went to 2 years of high school and fought in World War II and eventually became a 100% disabled American veteran. He instilled in us the possibilities of going to college, and of course I was the first one to go to college. I have two brothers that are physicians. And so, you know, this idea of making something of us here in America, getting a good education, and embracing the values that we have here was a big sort of thing.
I have this philosophy about the momentum of DNA, that if your parents are hardworking and striving, and they want a better life and they see possibility, a lot of times our parents don't get to realize what we realize, but the dream really starts and runs through their DNA. And I think it is in us, so that when we emerge with a portion of their dreams already coded into us, and you feel this force or momentum in your life, and you don't even understand why, you just have this drive. But I think you're carrying over the drive that starts generations back. You buy that at all?
I think I've never heard it expressed that way, but certainly that sense of, number one, sort of a pride in accomplishment and wanting to make people live up to those ideals that you see in your parents, and you know how much they put into getting you to a place where you could do what you needed to do in your life, and the sacrifice that they made, and that's you have to value that, and you have to do what it is that justifies what they've tried to create in you.
I thank you for being here today. We're going to take a break. When we come back, I want to talk about the possibility and future of healthcare in America, where we're going, what you see. I know as you lead your organization, one of the things that has been rooted in, when you came in, there were lots of things that needed to be fixed, changed, and moved forward, but you believe that it's possible to build a great organization and to make a great contribution in society. I want to talk about where we are now. Tony Spezia is my guest. You're watching Anything is Possible. More in a moment.
Possibility powered by Pilot Flying J, Covenant Health, Home Federal, and the Knoxville News Sentinel. Coming up,
we're having to change the way we operate. We're going to have to assume more of the risk of the cost of healthcare. But at the same time, when you're at risk for the cost, you have to understand you've got to still do what's right for the patient.
Welcome back to Anything is Possible. My guest is Tony Spezia. Thanks for being here. So I have this notion, like I said, your grandfather, your father, they come to America, they make a life really out of nothing, right? And you and your brothers benefit from that energy that was in them, that striving. And I see it in you as a CEO. I've met you years ago, and I've watched you take on challenges. And the way you take them on is unique because you think it can be fixed. Like whatever it is, we can figure it out. It may be tough, it may be whatever, but you believe it's possible to fix the situation. And I think that owes to parents and grandparents who step into a difficult situation. No, we can make this better. So thank you for being a possibility person and for being here. Let's talk about where we are in terms of healthcare in this community and in America, because I think a lot of what Covenant does, we want a healthy community so that people can realize their potential and their possibility. That's what great health care organizations do. They make the community healthier. It's not just an infrastructure, it is a possibility of better health. Where are we?
Well, you just stated our mission: improve the quality of life through better health. That is our mission, and so it's not just about treating people when they're ill, and which is a very important part of what we do, but also encouraging healthy behavior, encouraging attacking those things that have caused America really to lead the world in terms of chronic diseases, diabetes and COPD and lung disease, et cetera. And a lot of that is because of the fact that we have so much here.
Right.
And so because of that, that's what creates the disease burden and the chronic conditions that are so costly. And so I think if we can get after that a little earlier and improve the health of people and maintain health, we can manage our costs. We can do a lot to reduce the cost of healthcare.
Cost is a huge equation. I mean, anybody that has insurance, anybody that is trying to deal with healthcare, the insurance business is a business that tries to certainly support people but limit risk. So they've got to figure out the math on that. Since last we spoke, the Affordable Care Act is now the law of the land. That adds a whole new layer to it. Here in the state of Tennessee, there's been a dynamic conversation about Insure Tennessee and those people that are kind of in that gap, the working poor who don't qualify for ACA, but then.
Sure.
So, and in the middle of that are these healthcare organizations that try to deal with all of that. What's the number one thing in your inbox related to healthcare that you say, we've got to do something about this so that we can fulfill our mission so that people are healthier and can realize their possibilities?
I would like to talk about, the sort of the Tennessee and the national side, but there's a bit of a misconception. People think that healthcare is so expensive in America compared to some of the European countries and others. And of course, we have a great healthcare in our country, but what's interesting is that the cost per capita in the United States up until the age of 62 is exactly where it is on the other developed countries that we're often compared to and being more expensive. All the differential occurs beyond that age. And there's two reasons for that. Number one, our system, we think quality of life is really important for people that are 75 and 80 years old. So if we can do a hip replacement and give somebody 10 more years of being active and doing something, we pay for that.
Right.
Other countries don't do that. That's not a part of their healthcare system. And so it's a conscious choice that we make to say, we're going to continue to invest in people and invest in their quality of life.
How have you had to adjust as a corporate entity to deal with, we're going to take care of people. When you show up at a hospital, we're going to take care of you. But the numbers, the math, the metrics may change. How have you had to adapt in the last few years?
Well, you have to keep the patient first, always, regardless of what regulations and how people are trying to change payment models and trying to push risk, the risk of the cost onto providers as opposed to residing with the payers. These are all dynamics and things, but you always have to understand and sort of say, will I take care of the patient the right way if I adapt to what they're trying to do? And you've got to keep that always in the forefront. The fact is the government is broke as to health care, and they are trying to bend the cost curve, both the state as well as the federal government. And they're attacking it in ways that are challenging to everybody that's in healthcare, whether it be a physician, a hospital, or any provider. And so we're having to change the way we operate. We're going to have to assume more of the risk of the cost of healthcare. But at the same time, when you're at risk for the cost, you have to understand you've got to still do what's right for the patient.
Yeah.
And that is a important challenge if it's just going to be about the money. I look at behavioral health, which is, of course, a bit of a passion of mine, and Covenant has, one of the 10 largest psychiatric hospitals in the country here in Peninsula.
Why is that a big passion for you?
Well, it is because, first of all, when I came to Knoxville originally, working with a family business, they happened to own Peninsula and some other psychiatric facilities, and I got to work there and see
the need,
mm-hmm. and also the fact that pretty much everybody else was sort of exiting that line of business. It just wasn't profitable. People that were seriously and persistently mentally ill don't normally have coverage, and that's why this coverage issue is so important here in Tennessee, of getting people some coverage so that they can access care for their needs. You can't pick up, you watch the news and you hear about things that happen.
Yep.
And frankly, behind all of it, somebody brings up behavioral health.
Think about this plane that went into the Swiss Alps.
Just occurred. That's always sort of there. And the cost to society of us not really providing what's needed in behavioral health is huge. It hurts us in the jails, the judicial system, everywhere by not addressing those needs.
Let's stop for a minute here. We'll take a break. When we come back, I want to talk a little bit more about mental health and something that I think I discovered about your passion as a leader, as a corporate leader, that really kind of rang true today as you were sitting here. You're watching Anything is Possible. My guest is Tony Spezia. We'll be right back.
Coming up.
The way that you save companies is that you put, you don't do it on the backs of your employees. You get on their backs and they raise you up.
This week, our Home Federal Bank Community Spotlight is on the Second Harvest Food Bank of East Tennessee. Did you know that the Second Harvest Food Bank has been fighting hunger in our region since 1982? 12 million meals, 170,000 people each month. To learn more and see how you can get involved, visit secondharvestetn.org.
Welcome back to Anything is Possible. My guest is Tony Spezia. He's CEO of Covenant. We were talking about mental health. I think what I discovered when I moved back to Knoxville 25 years ago, Lakeshore was there. And at one point, Lakeshore was preeminent in mental health care, and they had 500 beds, right? And whenever the issue of mental illness comes up in a community, like if I remember a lot of discussions in our community. There was a model that said, let's see if we can, people that are dealing with this issue, let's see if we can reintegrate them into community, or could we build residential locations for them? And everybody's neighborhood was like, don't put it in our neighborhood, right? It seems like the prevailing notion was, can you just make it go away? Can we write a check, and can you just make this issue and those people go away? And, you know, we're called to kind of reach out to the least of these. And what I noted about not only the way you kind of manage Covenant, but this whole behavioral health piece is you want to see on the corporate side, the corporate infrastructure operate as efficiently as it possibly can so as to deliver on the promise of helping people.
That's exactly right. What we like to say is we've got to really run our business great so that we can have a big tent and we can take care of things. We lose, frankly, millions of dollars on behavioral health every year. But it's a mission of ours. And if we didn't do it, where would those 5,000 admissions go? Where would that outpatient treatment be? It wouldn't be here. We take patients from a wider area for mental health than any other thing that we do. We get people from Tri-Cities, from the Plateau. They all come here because there are no options. And one thing that's important to know is that mental health is one of the most treatable of all illnesses. We have phenomenal drugs if we can get people to be compliant with drugs, and that requires some support structures.
Right.
This is a very treatable disease. You don't have 500-bed mental health institutes where people are residents anymore. The average length of stay at Peninsula is 5 or 6 days. It's stabilization and discharge into outpatient treatment. And these are people that come with suicidal ideation, homicidal sort of things. They're a danger to themselves or others. And they're frequently, more than half of them are committed to treatment. To think that in 5 days they're back out and getting treatment and in the community. And so this is a really treatable thing. So if we go at this, we can in fact make people better and have them integrated into society. And there are all ranges of that, and there are some needs for some of that supportive living that you spoke about. But we have deinstitutionalized mental health.
So if we deinstitutionalize mental health, it means that there has to be an understanding on the part of the community and on the people that are served that we have kind of this collaborative responsibility to support great mental health services here and in the community.
And very very small amount of the percentage of dollars in healthcare needs to be spent in order to adequately address this.
Wow. Before you get away today, talk about your heart for people and where that came from in your family, because there's something about you that really wants, your brothers are doctors, you're an administrator in the healthcare field. I guess you got something from your parents about taking care of people.
Well, yes, and I think that, you know, it was kind of funny. We grew up, and I was the oldest of 6 children, and my father had a stroke when he was young, and I tell the story about when he used to wait on Augie Bush, who was the owner of the Cardinals and, of course, the brewery, which was founded in St. Louis. And when he didn't show up for work, when Augie comes in, and he'd always ask for my dad, and he said, "Tony, where's little Tony at?" And there was a big Tony and a little Tony at the restaurant. And they said, "Well, he's had a terrible stroke." And of course, you know, back then, I mean, he was paralyzed and whatever, and, you know, and I was still in high school. And Augie Bush said to the trainer of the St. Louis Cardinals, Bob Bowman, and said, "I want you to start going to Tony's house and get him on his feet. He's got to take care of his family." Now, this guy is, you know, in today's world, he's a captain of industry, the head of the brewery, the owner of the Cardinals, and he stepped out and said, "Here's this waiter that he knew just from a relationship at the restaurant who he got to know my dad, you know, and the family, and stepped out and did that." There's an example of someone doing something. Nobody hears about it, nobody knows about it, but we know. And so my father was always like that. When he retired, and he was a disabled veteran, he spent so much time at the veterans hospitals volunteering and just sitting down and talking to the guys. He'd carry the blood samples. That the head of the VA came to his funeral when he died, because he said, you were a model. So that idea really of taking care of people is important. My view of the people that work for Covenant Health is everybody's job is just as important to them and their family, regardless of where you are in an organization. And they need to have a secure place to work. They need to know that if they're working for us, that they don't have to worry that we're going to take care of the business, and that, you know, if you create that sense of security and give them a mission, because when they go home, they want to be proud of the place that they work at. Whether they're a housekeeper or a food service worker or a nurse or someone in administration. We need to treat everyone that way. And I've often said that, you know, sometimes you see companies when they struggle. And what do? Well, let's reduce the 401k contribution. Let's cut these benefits. Let's get rid of the vacation time. We haven't done that. We don't do that. Let's lay off people. That's not in our DNA. And my view of that is that, frankly, the way that you save companies is that you don't do it on the backs of your employees. You get on their backs and they raise you up. You have to depend on that.
You help your people, they'll help you help more people.
Absolutely.
Right, and I see that whole thing. You see Augie Bush leverage his influence to help somebody else. And now you're in a position of influence, and you can leverage that to help somebody else.
For sure.
That makes sense to me. That makes anything possible, right?
Absolutely.
Thank you for being here today.
Thank you, Howard. Great.
Tony Spezia. We'll see you next time on Anything is Possible.